Good afternoon, ladies and gentlemen. It's a pleasure for me to be here with you and share with you a couple of things. Some of the new technologies as well as some of the new initiatives that are happening worldwide to address this challenge of urban and rural divide in areas of health in particular. And I'll take the opportunity to thank Krishan for laying the foundation for my presentation, as he covered a couple of things already. But he gave you the context of India, and what I'll give you a more global context to that, and you can perhaps learn from what is being done around the world. And around the world, countries face similar issues. It's the issue of bandwidth, it's the issue of access, quality, and equity of care. And it's not just care, it's education, it's access to government services overall. Okay, so what we've done from a private sector point of view, we try to bring to the market, to the healthcare providers, new technologies that will help address the challenges. And when bandwidth is one of them, we integrate new standards that will limit the utilization of bandwidth when video is required. So Krishan mentioned that there is a protocol. It's a bit complex. It's called H.264 high profile. But what it does, it pretty much reduces by 50% the amount of bandwidth required for a high definition video conferencing call, right? Now, most of you have probably high definition TVs and full HD TVs. Well, in some cases, a high definition image is required. Not for everything, but in healthcare in particular. So I'll just go and look at the red bar over there. Standard equipment would require 1 megabit of bandwidth for a basic HD call. With this innovation called H.264 high profile, if you look at the green bar, only 512 kilobits per second are now required, which is enough bandwidth available in many areas throughout different countries. Now let's look at full HD, which what we call 1080p. Well, normally you would require 2 megabit of bandwidth for that video consultation to happen. Now only 1 megabit is required. Now, some of you may be using standard definition and would like to understand why high definition. Well, let me share simply with you that high definition is basically 3 times the quality of standard television, right? And it's also 9 times the quality of traditional video conferencing, which makes a lot of difference when you have to share medical images, whether it be videos or still images from point A to point B. We talk about access, right? Access to public services in general. And what I have seen worldwide is this concept of citizen service centers, e-community centers, or even local government units in certain countries. And what governments are trying to do is to have this one place where citizens can go to and have access to all kinds of services, whether it be for education, health, social services, justice, or even trade and civil services overall. And what we are working together with them is to enable all of this using video technology, right? So that from that particular center, you can have access to any kind of government department throughout the state or throughout the country in particular. So if you are a patient, you can have access to a doctor via video and be provided the care that you need. By combining all those services, when I say health, education, trade, justice, it's the same infrastructure. Why would we want to build silos or platforms that are separate from each other when all of this can be combined in order to reduce the overall cost of it and share that across the different ministries? I have a good example in the Philippines. The Department of Agriculture, they were looking at a video conferencing solution for their own use. But after we discussed, they realized that, wow, we're spending a lot of taxpayers' money just for us as a Department of Agriculture to communicate internally. So they quickly turn around and say, how can we make that infrastructure available to the people? So now what's happening in the Philippines, they have opened the doors to those video conference rooms so that farmers and fishermen can have discussions with the traders in Manila and some of the big customers overseas as well. Nobody would have thought, at least on the fisherman side or the farmer side, to invest in a video conferencing equipment to communicate. But this will help overall to improve and help the trade to foster in the community. So there are different type of solutions that can be installed in rural clinics to provide that teleconsultation Christian was talking about, for disease management, but also for awareness and education in all areas, but also, you know, to provide some public service updates as well. Of course, for clinical environments, there are more sophisticated solutions, like the one you see here that can be moved around the hospital or the clinic, to which you can attach any kind of medical peripheral, whether it be an exam camera, a stethoscope, an ultrasound machine, and so on and so forth. Now, what I would like to share with you now is a short video that will show you how in the US they handle emergencies in rural hospitals. That will give you an idea on how the technology is used and how it can help rural areas, hospitals in rural areas that may not have the resources required in certain cases.
It's no surprise to most of you that doctors can now read x-rays or share medical records over the internet. But did you know that they can also perform emergency room medical services on the web?
Yeah, it's called e-emergency, and it's saving lives and cutting healthcare costs in Minnesota and across the Midwest. 5 Eyewitness News reporter Tom Hauser shows us how it works, new at 10.
Were you on the ambulance with her?
You're looking at the future of medical care in America.
When you push on the chest wall, does she have any pain, Kathy?
An emergency room at a small Iowa hospital.
We have no radiologists.
Dealing with a sudden influx of car accident victims.
A semi ran into a car.
But the staff in this small ER...
The car has four to six passengers. I can't quite get the number, and the EMS doesn't know.
...has a new and important backup system.
We have both helicopters.
An ER doctor and trauma nurses at the much larger Avera McKinnon Hospital in Sioux Falls, South Dakota, are watching every move from 50 miles away.
If you had a time to shoot a portable chest x-ray, that would be great.
It's called e-emergency. The entire staff of medical personnel and specialists at a much larger hospital.
Hello, Dr. Koziak.
Linked via internet and two-way video hookup to dozens of smaller hospitals. They can monitor vital signs, look at x-rays, even zoom in on injuries. Hospitals pay to subscribe. Patients are not billed for the service.
You've doubled the physician that's in the room. You've doubled or tripled the amount of nurses.
Deanna Larson of Avera Health says they deliver e-medical services to hospitals across the Midwest, including nearly a dozen in Minnesota, from Marshall to Baudette.
Well, at any point in a 6-state region, you could have something catastrophic ongoing in one of those facilities.
The goal of e-medical services is simple and threefold. Help patients survive, let small hospitals thrive, and save the healthcare system millions of dollars.
Following up in the clinic there is a good idea.
Dr. Don Koziak says about 25% of the time e-emergency is called on to help, doctors in Sioux Falls are able to advise hospitals not to transport the patients.
They stay local to get their follow-up care. They stay local to be by their loved ones and to generate income for that hospital to help keep the doors open.
So I'll stop it there, but I think you're getting the idea of how it can benefit rural hospitals when they have a sudden increase of cases to handle, and they need to reach out to a center of excellence to get the expertise in a minimum amount of time. The other solution I would like to share with you is something that we are working on with a company called Home Video Care in the US. And in the US, it's meant for home care, right? But we know that in countries in Asia, that may not work, right? But I think this may have a potential in some of the rural clinics as well. As you can see, it's a phone, so you have voice communication, but it's also a video phone, so you can have face-to-face communication between the patient and the doctor located remotely. This phone also can receive information from different devices via Bluetooth technology, and those patient data can be, of course, be forwarded to a server somewhere and be integrated with electronic medical records, for an instance. There are other applications that can sit on the phone, such as alarms to remind patients to take their medicine, or even additional services like shopping and so on and so forth. But I thought of, showing you to understand that there are different types of solutions that can fit in a rural environment, not necessarily the high-end types of solution required, but very simple solutions such as a phone can pretty much do the trick in many, many cases. And of course, there are much more advanced projects that we're working on where you're talking about mobile hospitals, right? When hospitals are not available in certain areas. And here it's basically having a complete vehicle with an operating theater and all the equipment required to perform surgery and any care in any area of the country, especially in times of natural disasters. Okay, so we have many case studies that we can share with you in terms of rural health. This is the case of the Open Door Community Health Centers in the US, where you have 10 clinics in remote areas where they have face-to-face conversation with specialists. And we have other takes in Texas, for instance, where here it's much larger. It's 108 counties in Texas being connected to a main center of excellence, so to speak. So on this, I will end my presentation. But of course, I thank you for your attention, and feel free to ask questions later on.
Thank you. Any question? I think it's a fantastic presentation, so it would be great if we can ask questions and understand how to make this come alive in India, rather than limiting it to the United States. Any questions? So my question to you is that how easy or difficult to make this happen in India? Most of the example that
which
you
part?
most of the stuff that you talked about, mobile surgery or having the patients out there, somebody's not fully equipped to deal with that, but somebody on the other side helping them to deal with the trauma cases, right? There's a lot of stuff that you showed. Many of them are applicable to India.
Yes.
So tell me what can we do in India?
If we talk about e-emergency, as long as the main hospital can be connected in a certain way with a rural hospital, this can be deployed tomorrow. It's just a matter of, having the main hospital partnering with rural hospitals and finding the business model where, they would define how to cooperate, how to provide care, and so on and so forth. But this needs to happen at the local level. The example we have in the US, they say it's a free service that they offer to rural hospitals. Patients remain there, come back there for follow-up. I think those are workable models as well for India. If you're looking at the Citizen Service Center, where you have all government services, let's say, hosted at one place for the people, that requires a strong collaboration among different ministries at the state level. And today, the statewide area networks provide the connectivity. So you could have education, health, and others working together so that the tele services, so to speak, in all areas can be delivered, through those centers per se.
Terrific. Have your team, have they met anybody in the health ministry?
We have met a couple of...
It's nothing moving. What I would recommend is that if your team is out here in India, I think we should go and meet the NRHM organization, the ministry, and also we should get a chance to go and meet our health minister.
Sure.
So I'd be very happy to talk to your UMSOR as a local person, or if you are there, I think we should go and meet them and tell them so that they can visualize what they can do to our population. So thanks for this presentation.
My pleasure.
Looking forward
Thank
to
you for
take it
your
forward.
attention.
Thank you. There's the last topic, but it's a very important topic, which is very important to the country. Maternal mortality rate is pretty high in India. There's a lot of work that's happening, IMR and MMR. But I'm really delighted to have Dr. Jaya Singh. She's going to talk about Save a Mother Foundation. Thank you.